Hello, my name is Marialita Pierce, and I am from Pierce Pediatric Associates, and I am a general pediatrician. Today, we're going to discuss cultural competency in pediatrics. Our learning objectives for today, we want to make sure that we review the definition of cultural competency. We want to discuss and provide knowledge of cultural differences among families in your particular clinical practice. We'd like to talk about the ability to adapt your communication and your practice management style depending on each family and their situation. And we'd also like to make sure that we discuss and understand differences in health seeking behavior. So, the American Academy of Pediatrics also defines this as culturally effective healthcare. And that healthcare aims to provide healthcare in a manner that is respectful and sensitive to individuals of differing races, ethnicities, and it seeks to provide care that's respectful and sensitive of religious beliefs, gender differences, sexual orientation, literacy, and or socioeconomic status. It also seeks to value all individuals with different values, behaviors, and customs. So, why do we even say that cultural competency is important? Well, because it really helps establish trust in the patient clinician relationship. It allows all patients to maintain their autonomy. It helps to promote disease prevention. It provides opportunities for health promotion, and it also provides opportunities for health maintenance and health restoration. In my specialty, pediatrics, cultural competency is a little different because we have very long lasting relationships between our parents and our patients, who are the children, during their various developmental stages. And we feel that we can really influence and promote early language and literacy development. We can promote sound nutrition and exercise habits. We can aid our parents and guardians with social emotional development, as well as providing for disease prevention. And let's not forget, we also help our parents and their children with fundamentals of adequate sleep hygiene. During our visits and all primary care visits, we want to make sure that we're helping to promote trust and that we are providing a warm and welcoming atmosphere within the healthcare setting. So, this warm and welcoming atmosphere, we want to ensure that families feel when they arrive at our reception area, when they're placed in triage areas, when they're placed in different exam rooms. We want to make sure the entire team is helping to provide that warm atmosphere. So, our healthcare team may help parents and patients by inquiring of them how they would like to be addressed. Would they want to be addressed by their first name or a nickname, or is there a certain title they want us to use? We want to make sure everyone on the team is paying attention to our patient cues, especially regarding eye contact and the family's decision of whether they choose to shake hands or not. We also need to find out from our families if English is their preferred language for communication. We also want to make sure during that very first visit that we are thinking about what kind of factors can impact healthcare promotion or the patient's treatment. Do we have to consider cultural practices regarding alternative or supplemental treatments? We want to make sure that we inquire about any religious practices or beliefs that could affect care. We want to make sure that we are understanding any spiritual beliefs that could impact care. And we also want to make sure that we are aware of any lifestyle practices that families want to include in their healthcare decision making. So, we want to make sure that our communication style has flexibility, and we want to find out, does the patient or their family want to include other family members to share in decision making? We'd like to find out from our families if they prefer to receive their information verbally. Would they like to receive their information via written materials? Do they want materials to provide a message via pictures? Or would they like to have a demonstration of what they should do in order to provide good communication? So we also want to find out if the family wants to share in decision making, or are they the type of family that just wants to follow clinician orders? We want to understand the impact of health literacy in our communication with our families. So we'd like to really inquire if bilingual materials are needed for each clinical practice. We want to make sure that we have patient education handouts that are readily available for families that may have low literacy levels. We want to make sure that when we explain about disease states, that we are not relying as clinicians on using medical jargon, or if someone is providing social supports, that they are not using medical home jargon. In the case of pediatrics, we provide immunizations at almost every visit. So I'd like to remind everyone that vaccine information statements are available via immunize.org, and they are available in 42 different languages. We need to find out when we are meeting our families, we really need to find out if they want to work in a collaborative fashion, and we want to make sure that we are really understanding what is the family's description of the problem. Or if it's an adolescent, what is the adolescent's description of the problem? We want to make sure that we have a very easy, free flowing conversation and that it's an open discussion of the treatment goal and that everyone participates in understanding how to reach this goal. We want to make sure whenever we have conversations that we are allowing to be an atmosphere of trust so that a family can honestly and openly state to us if they don't agree with a plan or if they find it too difficult to comply. For those of us that are in teaching situations, we want to really make sure that our medical students or residents are not relying on a set statement of poor compliance without taking the time to understand why a family has not been able to reach a goal. So, when we're communicating in the healthcare setting, we want to really make sure that we are allowing our families the privilege to teach us about their family customs, their religious practices, and their cultural preferences. We want to make sure that parents are able to share with us information that they are receiving from the elders of their family because the elders may have a different point of view of how to deal with health problems. New families, while they're understanding and adapting to new children and new developmental stages, are always receiving input from the elders in their family. And that input sometimes is in direct opposition to some of the goals that we are setting. So we really want to have a good discussion. If while you're having a discussion, you're receiving by their body language or by their being uncomfortable and they're seeming hesitant, we really want to ask them to share with us what they are most worried about because we can't provide good guidance if we don't understand what they're worried about. sometimes we get some wonderful assistance and support from our community. So if your clinical practice is within a community health center, you really want to inquire if there are peer health educators available. And for those of us who are in active clinic roles as clinicians, you really want to make sure that you are able to attend meetings and that you can listen to strategies from the health educators about how to promote vaccines, how to set up health screenings, and how to go about helping with health promotion. We really have to be willing to learn from our community advisors because sometimes our families may not feel comfortable telling us about barriers to care. So if there's a case manager or community health worker that the family feels comfortable talking about, they will able to tease out if there are transportation problems, if a work schedule is prohibiting them from coming to follow up appointments. They can let us know if our families have financial worries or insurance worries, and they also can help us understand if the family has worries about immigration status or if the families are concerned about possible deportation. So, in summary, culturally effective healthcare is an ongoing collaboration between families and healthcare clinicians. Some of the strategies, not all, but some of the strategies for a busy clinician include providing an atmosphere of trust, respecting that there are different styles of communication, working on collaborative relationships with community advisors and teachers, and last but not least, willingness to learn from our families and patients. References are American Academy of Pediatrics policy statement on ensuring culturally effective pediatric care, implications for education and health policy, University of Washington Medical Center, culture, clues, communication, and National Center of Medical Home Implementation, Salud para Todos, improving health through medical homes. Thank you.